Hello and welcome to our YouTube channel. Please subscribe to our YouTube channel, share it with your friends and family. You will get more health related videos on this channel. Please watch this video till end to get complete understanding of fatty liver. In this video, we are going to discuss what is fatty liver, causes, signs and symptoms, treatment, prevention, complication. Our liver is an essential organ with the multiple life-supporting functions. Its mainly functions include bile production and excretion of bilirubin, cholesterol, hormones and drugs, metabolism of fats, proteins and carbohydrates, enzyme activation, storage of glycogen, vitamin and mineral, synthesis of plasma proteins such as albumin and clotting factors, body immune system, detoxification of chemicals. These are the functions of the liver. Now let's talk about fatty liver disease. Fatty liver disease is a common condition caused by the storage of extra fat in the liver. Most people have no symptoms and it doesn't cause serious problem for them. In some cases, it can lead to liver damage. A healthy liver contains a small amount of fat. It becomes a problem when fat reaches 5% to 10% of your liver weight. There are two main forms of fatty liver disease. First one is alcohol-induced fatty liver disease. Alcohol-induced fatty liver disease is caused by heavy drinking. About 5% of people have this form of liver disease. Non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease occurs in people who are not heavy drinkers. Now let's talk about symptoms of the fatty liver. People with fatty liver disease often have no symptoms until the disease progresses to cirrhosis of liver. Cirrhosis of liver is the result of severe damage of liver. The symptoms include abdominal pain or a feeling of fullness in the upper right side of abdomen, nausea, loss of appetite or weight loss, yellowish skin which is sign of jaundice, swollen abdomen and legs, extreme tiredness or mental confusion, weakness, pale stool, red palms are the symptoms of fatty liver. Now let's discuss about the causes of fatty liver. Some people get fatty liver disease without having any pre-existing condition, but these risk factors make you more likely to develop it. Drinking too much alcohol is the main reason of fatty liver. Being obese or overweight, having type 2 diabetes or insulin resistance, having metabolic syndrome, insulin resistance, high blood pressure, high cholesterol, high triglyceride level. Side effects of some medication, viral hepatitis are the causes of fatty liver. How is fatty liver disease diagnosed? Because fatty liver disease often has no symptoms, your doctor may be the first one to spot it. High level of liver enzymes, elevated liver enzymes like AST, ALT may appear on a blood test. For other conditions may raise a red flag. Elevated liver enzymes are a sign your liver is injured. If your doctor suspects that you might have liver disease, they will likely ask you questions about your family medical history, including any history of liver disease, your alcohol consumption or other lifestyle habits, any medical condition you might have, any medicines you might take, recent changes in your health. To make a diagnosis, your doctor may order ultrasound or CT scan to get a picture of a liver biopsy to determine how far advanced liver disease has progressed. FibroScan, a specialized ultrasound sometimes used instead of liver biopsy to find out the amount of fat and scar tissue in the liver. Next, how is fatty liver disease treated? There is no medication specifically for fatty liver disease. Instead, doctors focus on helping you control factors that contribute to the condition. They also recommend making lifestyle changes that can significantly improve your health. Treatment includes avoiding alcohol, losing weight, taking medication to control diabetes, cholesterol, and triglycerides, taking vitamin E. How can fatty liver disease be prevented? The best way to avoid fatty liver disease is to do the things that maintain overall health. Stay at the healthy weight. If you are overweight or obese, lose weight gradually. Exercise regularly. Limit your alcohol consumption. Take medicine as prescribed. Eat a balanced diet. Reduce the use of food having high lipid content. Now let's discuss about the complications. Liver failure, liver cancer, fluid buildup in your abdomen, chronic kidney disease, physiological dysfunction, gastroesophageal reflux disease, sleep apnea, cardiovascular disease. Now let's discuss about the stages of fatty liver disease. Stages of non-alcoholic fatty liver. There are four main stages. Stage 1, steatosis. Simple liver fatty liver is a stage where there is a largely harmless buildup of fat in a liver cells, but not to an extent to cause symptoms to appear. Non-alcoholic steatohepatitis is the serious form of fatty liver disease and occurs if the liver becomes damaged, causing to the become inflamed. Stage 3, fibrosis, occurs when persistent inflammation causes scar tissue around the liver and nearby blood vessels, but the liver is still able to function normally. Stage 4, cirrhosis. The most severe stage happens when normal liver tissue are replaced by fibrosis to extent that the structure and the function of liver is affected and can lead to liver failure or liver cancer. Alcoholic fatty liver occurs in three stages. Stage 1, cirrhosis. Fatty liver is characterized by excessive accumulation of fat inside the liver cell. Heavy drinkers usually get to fatty liver stage in their early year of alcohol abuse. Stage 2, alcoholic hepatitis, is characterized by inflammation of liver leading to degeneration of liver cells. Jaundice is the most common symptom in this stage. Stage 3, liver cirrhosis, is the last and final stage of alcoholic liver disease, where permanent scarring of healthy liver tissue occurs. It is a severe condition and irreversible one. Thank you so much. Now let's see what a patient of fatty liver disease can avoid or eat. In general, the diet for a fatty liver disease patient includes fruits and vegetables, high fiber plants like legumes and whole grains, fish and seafood, olive oil, nuts, vegetables. Let's see what should fatty liver patient avoid. Alcohol. Alcohol when can be a major cause of fatty liver disease as well as other liver disease. added sugar. Stay away from sugary foods such as candy, cookies, sodas, and fruit juices. High blood sugar increases the amount of fat built up in the liver. Fried foods, these are high in fat and calories. Added salt, consuming too much salt can increase the risk of non-alcohol fatty liver disease. It is recommended to limit sodium intake to less than 2300 milligrams per day. People who have high blood pressure should limit salt intake to no more than 1500 milligrams per day. White bread, rice, and pasta. White flour is a typically high processed and items made from it can raise your blood sugar more than whole grains due to lack of fiber. Red meat, beef are high in saturated fat.